great honor to welcome you to the 2024 PSHAN Annual Conference with the theme, Harnessing Private Sector Solutions for Universal Health Coverage in Nigeria's Evolving Health Insurance Landscape.
So as the public health need emerges, we have a strategic plan that responds directly to those needs in a holistic manner.
Good morning, everyone. Thank you so much for being here. This is a very cold morning, and we know the effort that was involved in having you all here.
At the Nigeria Center for Disease Control and Prevention (NCDC), we recognize and celebrate the invaluable contributions of our private sector partners who have embraced the challenge of promoting health insurance.
That you need to pay attention to the size of the problem and then to the part of the problem you can solve, and bring all of us in to the part you cannot solve and not try to do everything and crowd us out.
These hospitals actually operating. From our own work in PharmAccess, we have seen in Kwara State and in Lagos State, some of our work, that if you do these strategic purchasing contracts, you can actually improve the situation to a certain degree, but recognizing it's not enough. And if you're a private hospital, and we are here about private healthcare facilities, you struggle to access the financial investments that are needed to invest in your hospitals to expand our services or improve the quality of care. So all of this is resulting in this vicious cycle of demand and supply, where people don't trust the system because every time they go to a facility, they see that it's not working. But because nobody is prepaying, including those who can pay, so an increase of resources, we're stuck in this virtual.
They made me understand that they've been able to cover over 300,000 vulnerable people in Lagos State via the Eco Social Health Alliance.
That's the point that I'm trying to make. We haven't failed. We're on this journey, and that data-driven decision making is what we're lacking.
They can get cost reductions, seems to favor the sustainability of health insurance.
So that means for the next 20 or so years, an adequate platform to capture so many things going on, so many fields of data, age, sex.
So we pick the ones that work for us in our space and run with them, and also build on them, so that we can actually have a Nigerian-owned health insurance system. What works in the UK or America or indeed Ghana, Togo, may not necessarily work for Nigeria. We need to have a homegrown one.
The countries that have run public health insurance have struggled. We know what's happening in the NHS. She says more than 50% of their providers are private. The private sector does come with a lot of competencies, and the role of the NHIA should be regulation.
I conclude by saying that we must all embark on this transformative journey. We must also remain committed to ensuring that every Nigerian has access to quality healthcare.
As we move forward, let us carry the momentum of today's discussions into our daily work. Let us continue to forge strong public-private partnerships, invest in cutting-edge technologies, and implement best practices that will drive sustainable progress in our health sector.